So without further ado, let me introduce Dr. Steve Schachter from the University of Harvard. It is a quite single presentation for Dr. Schachter. He is a clinical neurologist from the Massachusetts General Hospital, is founder and editor-in-chief of Epilepsy and Behavior, has great experience with clinical neurology, basically with epilepsy, is the coordinator of the CIMIT, which is a joint program between University of Harvard and MIT. And I can say this is a friend of ours, and over the year we have collaborated into the edition and production of issues on epilepsy and behavior. It's a great pleasure and an honor to introduce him to do this keynote speech today.
Thank you. Obrigado. Good evening, everyone. It's a pleasure to be here. I know many of you were expecting Dr. David Prince to give the keynote address, and unfortunately Dr. Prince can't be here with us tonight, so I'm plan B. You might say that I'm a commoner to the Prince, but I hope that you enjoy this presentation. It's going to be very light on the science, but hopefully thought-provoking and setting a stage for this meeting, because my plan is to have us look at some art created by contemporary people living with epilepsy. Many of these artists make their living through their art, and many of them have expressed through their art the complexities of epilepsy in their own way, and I think in ways that can inspire us as scientists and clinicians. And I've also dealt in their art with many of the comorbidities that we will be discussing throughout this meeting. Why should we spend the next hour or so looking at art and thinking about the patient's point of view, the patient's perspective? I'd like to show this quote from the Journal of the American Medical Association 60 years ago. The first author was William Lennox, whose name you recognize in the Lennox-Gastaut syndrome. And 60 years ago, he and a colleague said that physicians who treat patients who have epilepsy must match drug and surgery therapy with practical socio-psychological therapy. In other words, paying attention not only to their turbulent brain waves, the EEG, not only to the serum levels of seizure medications, but also to their disturbed emotions. For this meeting, we could substitute comorbidities for disturbed emotions. So Lennox really, I think, said it 60 years ago, the importance of looking at the patient as more than just seizures, that epilepsy is the sum total of the impact that the condition has on the individual and their family. So it is in that spirit that I offered this talk, and I will divide my talk into 3 sections. First, just a little bit of a background as to how I came across this art and collecting art of people with epilepsy over a number of years. Most of the talk, oops, sorry. I'm not sure why that happened, but the majority of the talk focusing on the themes of the art and what perhaps the artists are trying to express through their art. And then finally, coming back a little more to scientific inquiry, discussing how we can perhaps use the art of artists with epilepsy as windows into their brain function and go beyond their experiences into trying to better understand the correlation between their art production and brain function. So this journey of mine with art of epilepsy began probably close now to 20 years ago. One of my patients in Boston herself an artist, owned an art gallery, and she started a support group that met frequently, composed of other artists who had epilepsy, and they would get together and discuss the day-to-day issues associated with epilepsy as it related to being an artist. To what extent did seizures serve as a barrier or even as an inspiration to the art, medication effects, and so forth. And the group eventually decided to put on a show, an art show in Boston. And I was fortunate enough to be able to help with the setting up of the show. And it was the works of many of the artists in that support group and many others that they had known. And it lasted for probably a couple months in Boston. And then it went on the road, so to speak. It became a traveling exhibit that made its way across the United States and eventually to Canada and Sydney, Australia, where it was shown at the International Epilepsy Congress in 1995. Much of the art I've published in this book, if you can see my pointer here. I'm looking at it backwards, but I think it's here. The book called Visions, and we have a couple copies that we will be giving as prizes at the end of the meeting on Saturday night. I became, of course, fascinated with this, and it became known that I was collecting art of people with epilepsy, and many colleagues who had patients that were talented artists would encourage their patients to send me their works and so forth. So over these years, I now have probably closer to 1,400 different pieces of art from well over 50 or 60 artists. Much of this now is digital files, but in the early days, it took up a lot of room. And it's been just a wonderful experience. Tonight, I'll be showing some of this collection. And in the collection, I would like to suggest that there are 4 general themes that I think we can understand in the art that I'll show. The first theme is the experience itself of having a seizure, which, for those of you who've cared for patients with epilepsy know can be a very difficult experience to talk about using words. But since many types of seizures have a visual component to them, these artists have chosen to express their own seizure experiences through their art. And not only the seizure experiences, but the postictal state, the period of time after a seizure as well. Another theme that we'll look at relates to the psychiatric comorbidities, which we will spend most of our time here at this meeting discussing. These include mood disorders, particularly depression, but also anxiety and psychosis. The third category are the daily psychosocial aspects of living with the diagnosis of epilepsy, apart from the actual seizures itself and apart from the mood disorders, but the experience of living in this world with that diagnosis. And then the fourth category is just beautiful art for art's sake that ostensibly has no connection to epilepsy other than to be an opportunity to make the point that people with epilepsy are not to be defined by their condition, but can be productive and gifted, creative people in their own right, which is a message that unfortunately we still need to convey because of the continuing stigma and discrimination that is directed against people with epilepsy. The very latest example of this being just this past Sunday when the coach of the Minnesota Vikings, a U.S. football team, had a seizure at the end of the game, and a news report suggested that he was unfit to be a coach in the NFL. So let's start with the art that addresses the ictal experience and the post-ictal experience. Here's an artist who writes that there are many times during her seizures that her world seems unreal or surreal. like she's in a dreamlike state. And of course, we've heard of seizures, certain types of seizures being dreamy over a century ago. As an artist, I try to make sense out of that dreamlike state and who I am while I am in it. And this is how she draws her self-portrait during the ictal period. Here's a patient who has elementary visual hallucinations, which typically arise from the occipital or occipital-parietal region. Of course, it would not be a static picture, as it appears here, but a dynamic, changing picture. Another largely visual seizure, and of course it bears mentioning that most of these patients remember this phase of their seizure, which is why they're able to later draw it. In other words, they've not lost consciousness during this part of the seizure. This is a photographer whose seizure arises out of the part of the brain that is responsible for facial recognition. And during her seizure, it appears as if the face is difficult to reconcile in this way. This artist, who happens to be the woman I mentioned at the beginning that owns the art shop in Boston, the gallery in Boston, writes that during her electrical firings, which is her way of describing her seizure, her visions flourish, and she hallucinates indescribable visions. She feels virtual slivers slicing her throat when she draws the air to describe them. She feels physically sucked down into an explosion, fumbling through chaos and landing disembodied from the intensity. A very graphic description of her seizure, and this is how she draws it, paints it, showing the heat and the disconnection of her head, her mind, from her body, the so-called out-of-body experience. It looks very painful, this experience. Another visual seizure. Now moving on to the post-ictal state, this artist writes that after a seizure, she has an overwhelming sense that everything she knows intellectually to be in the present and in the here and now is actually feels, sorry about that again. Note to speakers, you cannot hit the podium. So during the post-ictal stage, she feels everything is distant in time and space, like the recollection of an old memory. She has a powerful sense of anguish, pain, and loneliness. And this is how she draws her understanding, her recollection of after a seizure, the post-ictal state. In fact, for her, this is the first thing she has a memory of associated with her seizure, because just moments after her seizure begins, she loses consciousness. When she regains consciousness during the post-ictal state, this is how she feels. It's obviously a very frightening, horrific experience, yet this is her reality during that period of time. Flying through space, tethered to Earth just by this umbilical cord-like structure, mutilated, very painful. How can you possibly, put this into an accurate description? And of course, this is so singularly unique to this individual that you won't find anything like this, in a textbook of epilepsy. Other people after a seizure feel ugly, feel ashamed, do not feel human, may be quite depressed, if not suicidal. Andy Cantor in the audience has done a lot of work in this particular area. So this is a post-ictal self-portrait. Another one where this individual thinks that she appears to be ugly in this way, this dysmorphic face to other people. You can see the saliva coming out of her mouth. Now, moving on to the psychiatric comorbidities, mood disorders, anxiety, and psychosis, which many of us here in the audience have studied clinically and scientifically. How do artists depict this? Well, there's no doubt, looking at this self-portrait of depression, and of profound depression, the profound depressive state. Same with this particular image. And the artists or the patients that we see with depression may not themselves necessarily know that this is a comorbidity of epilepsy, but they are not at all surprised to learn that they are profoundly depressed, because they can tell you that in words and through their art. Anxiety is quite common as a comorbidity, as we know, particularly generalized anxiety disorder. This artist feels at times like he's standing in front of an oncoming train with nowhere to escape, which of course would be quite an anxiety-inducing experience. Another sculptor from the States whose self-portrait here is literally tightly wound string or metal, which is how she feels from her anxiety. Jealousy and envy is an emotion. I'm not sure it's an illness or a condition, but it is a feeling that many people with epilepsy have. Jealousy of siblings who are well, jealousy of friends who are able to go to school or to work productively. The title of this painting is Envy. Rapid cycling mood disorders, dysphoria can be seen. Here in one picture you have a rapid sequence under a full moon, which we have outside tonight, of profound happiness through sadness and anger, expressing a rapid change in mood. Psychosis, paranoia, which can be seen transiently after a cluster of seizures or as a more enduring interictal state, is a less frequent but nonetheless very serious comorbidity, psychiatric comorbidity of epilepsy. And here we see a number of eyes looking right at you in a very paranoid sort of way. Here is somebody's world literally falling down, the sense of reality and what we assume to be true of the physical world challenged through this psychosis. Now moving on to the theme of living with epilepsy, living in society, living around people who may or may not know that the artist has epilepsy. Within this particular theme, which is probably the most frequent theme that I see in the art that I collect, there are several sub-themes, if you will. The first is the notion of loneliness, being alone even surrounded by people, feeling isolated, feeling separate and apart from society. Another theme is the stigma, the discrimination. And the third are the daily reminders of living with epilepsy, besides seizures themselves, which serve, unfortunately, to reinforce the stigma, particularly the perceived stigma, self-perceived stigma, and reinforce the sense of loneliness. So here's a painting of a German artist with epilepsy. As you'll notice, there are no people in this image. So this person who's walking this path from morning, if you can see my pointer, from morning to night is walking it alone. The cracks in the path signify gaps of time from seizures, but quite, as you can see readily, quite a isolated, lonely existence in the mind of this artist from day to day. Again, a feeling of just being alone, insignificant, unappreciated in the world. Some of our patients, much like this artist, only feel human or feel validated in the home setting or in the doctor's office. How many of our patients, those of you who are clinicians who come to our office quite frequently and with a change in their medication, their seizures come under control, and you think you're delivering good news when you tell the patient, you know, you're doing well, you can come back in a year or 6 months or a year, whereas they were accustomed to coming much more frequently. And you expect them to be happy with that news, and many are, but how many of those patients insist on seeing you as frequently as they ever have? And I think one of the reasons for that is because in your office, with you, with your staff, they feel like people. They feel valued, unlike how they feel in society at large. And you wonder, what is the basis for that feeling of loneliness and feeling different? Well, imagine as this artist puts you in the position of somebody waking up from a seizure on the ground. And imagine you're waking up on your back, coming to, and you see people looking down at you because they're still standing. So they are literally looking down at you, but over time, I can only imagine this may translate into being figuratively looked down at you, meaning looked down as different, as less than human, as being below the usual level of society. That's the point that's made in this painting. This is a portrait of Saint Valentine. Saint Valentine is considered the patron saint of epilepsy, not because he himself had epilepsy, but because his name in German means falling. And of course, epilepsy has also been called the falling sickness. And in this portrait, the artist shows people with epilepsy below street level, below the level of other people living in the world, reaching up, wanting to be brought up into mainstream society, looking to St. Valentine to make this possible. People can feel lonely and different, even surrounded by others in a public space, which is the message, I think, of this photograph. Now, by way of explanation, when we talk about stigma, we talk about actual stigma, which is when somebody who has a condition such as epilepsy is actively discriminated against because of the diagnosis. So being refused entry into a school or being refused a job on the basis of the epilepsy. We also call that enacted stigma. And then there is perceived stigma, or self-perceived stigma, which is in the mind of the person, him or herself, with epilepsy. It's how that person with epilepsy believes others are looking at them. This is particularly a problem in older people that develop epilepsy after 40, 50, 60 years, because the misunderstanding that they carried with them all those years about epilepsy, they're now turning on themselves and imagining that others are looking at them the same way. So the message of this photograph is the fact that this person with epilepsy believes that others in this public space are viewing him as a clown, as a less than normal person. So but yet you look at this photo, and in fact, no one is actually looking at this individual. So this is what he is imagining others are thinking. And this form of stigma, this perceived stigma, can be very difficult to help a person with epilepsy get over, because it's internal to them. Whether or not they've ever been actually discriminated against, they may carry with them this psychological burden that others are feeling a certain way about them. And this has profound implications for any kind of social activity, for choosing who to disclose their epilepsy to, and so forth. The daily reminders of epilepsy, which we don't pay much attention to, but yet are constant reminders of the diagnosis to the person with epilepsy who may be struggling with the associated mood disorders and with the psychosocial consequences of epilepsy, the dependency, the fear of when the next seizure is going to occur, the difficulty with all the transportation issues and so forth. And the pill bottle, of course, is one of those daily reminders. Here is a sculptor who developed epilepsy post-traumatically. He was an attorney and no longer able to practice law, and discovered his artistic talent. And to him, the message of this sculptor is that from one day to the next, living with epilepsy can be as if you twist a Rubik's Cube into a certain conformation. And whichever outwardly facing surfaces with their specific experiences show, that will be that person's day. And the concept that it's somebody else who is moving the Rubik's Cube, not the person themselves, that we refer to this as locus of control. Who does the patient believe has control over their lives? You know, because most of us believe that we do. We control our own lives to a large extent, understanding that there are chance events we cannot fully predict. But the person living with a condition that unpredictably can cause disabling, if not potentially fatal symptoms, may come to conclude that their locus of control is external to them. And the message here is that the person or the entity doing the controlling is twisting a Rubik's Cube, and that will set the stage for a particular day. The locus of control may be us, maybe the physicians. The patient may believe we're in control of their lives. And, you know, it's not a far stretch of the imagination to understand how somebody can conclude that, because after all, we're the ones prescribing medication, providing information, providing guidelines, suggestions for living. And here is not a flattering painting of a physician to whom the patient is praying, much like to a religious figure, praying not for communion, but for the anti-epileptic drug to keep the patient's seizures controlled. And the editorial comment here, for those of you that can see the words here on the pocket of the physician, is pharmaceutical companies. The patient believes that the control really not just comes from the physician, but from the manufacturers of seizure medications. Another daily reminder for many of our patients living with side effects are the side effects. And as clinicians, we take a history, we ask the patient what side effects they're experiencing, but sometimes we forget that they're having these side effects, and what is the impact of having trouble sleeping, mood disorders from seizure medications, and in this case, this painting, double vision. Many of our medications cause double vision because they impact the brainstem. And you know, if you cross your eyes and the world becomes double, you understand how uncomfortable this is. And yet, you know, many of our patients have to put up with double vision on a daily basis for prolonged periods of time. Or other symptoms of seizures. And this is the one piece of art I'm showing that is not from a contemporary artist. You art historians will recognize this as by Van Gogh, called Starry Night. And there have been a number of interpretations of this painting, but let me choose one that's consistent with the previous slide, which is that it's a side effect of his medication, which was foxglove plant, from which we get digitalis, which was prescribed for seizures to Van Gogh. In fact, one of his portraits of his physician friend, Gaucher, shows the physician holding a sprig of foxglove. Sometimes the physician generates the reminders of living with epilepsy, such as the EEG or the MRI scan. And Some of our patients may have difficulty drawing a boundary between themselves as people and their test results. And perhaps it doesn't help when we give a talk and we say, this patient, and what we're referring to is their EEG or their MRI scan, but this artist is struggling to draw the boundary between himself and his test results. The same here, perhaps a more artistic rendering of a slow wave, but nonetheless an EEG pattern. Of course, the daily reminder of seizures themselves are an ever-present threat to many of our patients with drug-resistant epilepsy. And the patient may fear not only the seizure, but what the consequences of that next seizure will be. And here we see the woman barely treading water, and you can imagine if this EEG is moving in time and then she has a seizure with the spike waves, that it would be then difficult to hang on anymore and she will drown. Epilepsy surgery, or the prospects of epilepsy surgery, of course, we view as an important, potentially curative process, but as we know, many patients view it as highly invasive and disruptive. And here we see not a very accurate portrayal of a neurosurgeon's tools, given the mallet and the other tool here. It's this patient's perception of what the meaning of having an intracranial procedure is. But happily, for at least this patient, while he was still in the hospital following his lobectomy, he was able to draw this self-portrait. And I think this is indicative of something you hear from artists with epilepsy, not just visual artists, but also musicians and others who depend on creativity, wondering, what will be the impact to their creativity, to their abilities of seizure medications, or in this case, of epilepsy surgery. There was a story done of a violinist some years ago who underwent a temporal lobectomy. I think it was at the Cleveland Clinic. And the documentary shows her very soon after the operation getting up and playing her violin and being pleased that she was able to do that, and even after a second procedure was done as well. Now, as we are entering the high-tech, the technological phase of epilepsy treatment, as exemplified by the vagus nerve stimulator, by deep brain stimulation, by the NeuroPace device, and by others in earlier stage development, at least this one artist is starting to worry that with these technologies embedded in her, she may transform from a human into some form of a robot or a non-human, wondering, again, where is this sense of control going to reside? Is it still with her, or is it with these technological devices that are being implanted in her? And when you talk to patients about some of these technologies, they may express, if they're being open with you, some hesitation, wondering, again, what will be the effect on them as people, not just on their epilepsy. Of course, the most feared and ultimate reminder or aspect of living with epilepsy is the possibility of sudden unexpected death, SUDEP, which we probably won't discuss much at this meeting, but does enter into the art of people with epilepsy. This painting is from the father of a woman who died after complications from status epilepticus. She was in a persistent vegetative state for some time, and this hand showing a dystonic posture was her hand during that period of time. But she eventually died, and a very powerful, moving painting that expresses the extreme horror and sadness of a parent losing a child with epilepsy. And I'm privileged to have one of the prints of this piece in my office, and looking at it reminds me of what we need to do as a community to arrive at the day when no parent has to worry about their child suddenly dying from epilepsy. Now, I'd like to show the fourth theme, which is just art for art's sake, and go through these fairly quickly. Again, as I mentioned some time ago, I think it's important for us to celebrate the accomplishments of people with a stigmatizing condition like epilepsy, because to those who harbor this stigma, it's an indication that the individual cannot and should not be defined by their epilepsy. And any chance that I have of showing this art during talks or on the covers of magazines or books, I do so. And again, I don't know from the artists' statements that they send me often with their art that there's a direct connection to their epilepsy. It's just that they are artists who find inspiration in the world to show in their work. I pause on this one because you would not believe that this artist is chronically hemiplegic from a stroke and is essentially homebound in in Plymouth, England. And yet you see the joy and the brightness of this particular outdoor scene, which you imagine he's walked through many times, but he's been, as I say, essentially bedbound for decades from his stroke. This artist happened to be a patient of mine, and her art reminds me of Chagall. Beautiful still lifes. This individual is an art professor in New York who has epilepsy. Computer graphics. We see a wide range of media in the work, which adds interest to it. I do have some movies and some animations as well that is more difficult to show in a setting like this, but captures the dynamic aspect, particularly of seizures. This is an Australian artist depicting Aboriginal individuals. Here's a quilt made out of cans of soda that had been emptied, of course, Coke cans. And he somehow tied these cans together to form a very large quilt, because as you can see, each individual element of this is was a can of soda at one time. This is from a German artist, and he calls this herring, which is the type of fish. These next few images are from a Canadian artist whose work does hang in a number of museums. He had a twin brother, also who had epilepsy, and who died in early childhood. And the artist lived a full life and died from unrelated causes. But his work is quite beautiful, large landscapes. So just a sampling. Of course, I don't have time to show you so many, but a sampling of the beautiful art that we can appreciate, and we can, and helps us to remember that putting aside comorbidities and putting aside the experience of living with epilepsy, that a person can have epilepsy but epilepsy may not necessarily have them, that they are able to be creative and be productive in our society, which should be our goal as clinicians, to help people, such as these artists, to live to their full potential, whether it's as artists or scientists or teachers or whatever it might be. Now I want to conclude by suggesting that there may be some opportunity for scientific inquiry looking at art from people with epilepsy. There have been individuals around the world that have tried to do this, have used this approach as the basis for a master's or PhD thesis. And I think that there is a lot of opportunity to evaluate art, not only of artists, but also people with epilepsy who may not have well-developed artistic skills, because it could be that within the elements of their drawing, the subject matter, the use of lines, the use of color, the attention to detail, that they may correlate, may be found to correlate with certain clinical variables that may be of interest, and may correlate as well with the neuropsychiatric comorbidities. I'll give you one example of this, and that is obsessiveness, or attention to detail. And this is a personality trait that's been discussed in the literature in regard to JME, juvenile myoclonic epilepsy. And here's an artist who, even in their own writing, acknowledges that they are obsessively focused on detail in their drawing. And this type of obsession may make them commit hours and hours to their work, to their art. Not unlike the hypergraphia that has been talked about as an interictal personality attribute by some. I know this, or I can sense this when I get a file, a digital file from an artist, not by email attachment, but by Dropbox or some other way of delivering a huge file. I can then understand how much detail there is in this painting. This, for example, a picture like this might have been 35 megabytes in size. And the same for this. So this is just one specific example of how an analysis using well-validated tools of creativity that assess creativity or that assess artistic ability may be of interest in studying people with epilepsy. Would these investigations correlate with specific neuropsychiatric comorbidities? Would they correlate with particular epilepsy-related tests, such as EEG or MRI scans or neuropsychological tests? And could they suggest or be indicative of forms of cognitive dysfunction, or alternatively, forms of enhanced cognition that we don't routinely investigate in our patients? But I think, one conclusion from looking at this work is that perhaps some people with epilepsy, for whatever reason, enjoy above average, if not superlative capabilities and specific skills. So to summarize, I think the art of people with epilepsy, as we've seen tonight, can help us as a scientific community understand what it means to have epilepsy from the patient's point of view, with all of its complexities and comorbidities. We just need to infer these from the art, and perhaps then translate the art into methods and techniques that we can use in our work. The art can also help persons with epilepsy gain understanding and acceptance, not just from us, the scientific community, but from the public as well. And I think studies of persons with epilepsy using art, which I think is a wide open area of inquiry, may help us understand better not only their day-to-day experiences, but epilepsy-related brain dysfunction, and apropos to this meeting, the neuropsychiatric comorbidities of epilepsy. If anyone here is interested in further exploring this area, I encourage you to email me. If you have patients who are gifted artists and you'd like them to communicate with me, here's my email address. I'll try best as I can to put their work on the cover of a forthcoming issue of Epilepsy and Behavior. So with that, I thank you very much.